A lot of ignorance out there, both among the lay public and surprisingly more ignorance sometimes among the medical fraternity as well.
In what
In
way?
fact, we solve problems in other people's specialties.
I think let's go speciality wise.
Today we want to cover a very unique topic. It's not just pure plastic surgery, but it's how plastic surgery interacts with other specialties of medicine.
Right.
The reason I thought of doing this podcast is to inform both the doctors out there and the general public that plastic surgeon's field of influence is much wider than what is popularly thought to be plastic surgeon's field.
Agree. So in short, what is plastic surgery again?
Very difficult. I would say it's a specialty where the surgeon is specially trained to look at problems in an analytical way and find solutions using body's own tissues most of the time, moving tissues around and using all the various skill sets and tricks up the sleeve to solve the problem.
No wonder our slogan, Dr. Mohan Rangaswamy, where dreams come to reality with precision and care. Yes.
You made that.
Of course.
You made
Yes.
that.
That's why I was
Yeah,
like, no, I
that's
need
why
to
you should
remember it. Yeah, I do. So let's start alphabetically. We will start with Anesthesiology.
Yes, anesthesia is a service provider specialty
Hmm.
which enables surgeons to do surgeries. Okay.
Right.
So how does plastic surgery interface with it? Because why? There are times when seeing a plastic surgeon early on in the disease course completely changes the course of the
It
disease.
changes the game.
Which speeds up the healing and brings a completely different perspective. Today we want to cover a very unique topic. It's not just pure plastic surgery, but it's how plastic surgery interacts with other specialties of medicine.
Right.
The reason I thought of doing this podcast is to inform both the doctors out there and the general public that plastic surgeon's field of influence is much wider than what is popularly thought to be plastic surgeon's field.
Agree.
And there's a lot of ignorance out there, both among the lay public and surprisingly more ignorance sometimes among the medical fraternity as well. Now, why is this? I think this is because of a couple of reasons. One is that in medical curriculum, plastic surgery is not included at all. In basic medical education, there is no mention, there is no posting, there is no lecture on plastic surgery.
Physiology, pharmacology.
All that and all the other medical specialties, but there is no mention of plastic surgery
True.
at all. So most doctors who qualify and then further go on to become different specialties, they have no idea what plastic surgeons do.
Anatomical division is not there.
And the other reason is plastic surgery is not restricted to a body part or to a disease
Exactly.
or to, a tissue, for example. Ophthalmologist, directly it's eye. So anybody who has a problem with the eye, he knows or she knows,
They have to
go
go
to
to an eye
the
doctor.
eye doctor.
Right.
But plastic surgery is not restricted to anatomical area or to disease. Okay.
Right.
So these are probably the two main reasons that people don't realize how much plastic surgeons provide, their expertise to different branches of medicine.
right.
So today we thought, both for the doctors out there who might be our listeners, our valued listeners, and also for the interested general public.
Yes.
Because why? There are times when seeing a plastic surgeon early on in the disease course completely changes the course of the
It
disease,
changes the game.
which speeds up the healing and brings a completely different perspective. Something which is very challenging in one specialty doesn't seem to have a solution. The moment you consult a plastic surgeon, I'm not saying for all problems, but there are many, many problems, and I can recollect innumerable examples in my career where, once when I say my specialty comes into the field, everything changes.
Right.
Because we take a fresh look. Our way of looking at problems is completely different.
Totally different.
We analyze things in a different way, and we have a huge toolkit of various things that we can offer, from grafts to flaps to moving tissues to wound healing and so on. So we are able to offer our services. So the third way of looking at plastic surgery specialty is it's a problem solving specialty.
In what
In
way?
fact, we solve problems in other people's specialties.
Right. Problems like, okay, let's go speciality wise.
Let us do that.
Yeah.
But
Let's do
before that, I just want to say one statement
Uh-huh.
that in any plastic surgery textbook, the first chapter, let's say introductory, every textbook talks about the dilemma and the difficulties in defining what plastic surgery is, and ultimately leave the reader where he started. What is plastic surgery? It's still not clear. So
every book has this. Huh?
every plastic surgery book has this. So basically, if we want to look at plastic surgery a little bit philosophically, it's a specialty where the training and the thought process and the repertoire and the toolkit that we have, this distinguishes us from any other specialty. We feel comfortable working with anybody in anybody's area. I can work. Like an ophthalmologist will be very uncomfortable working with an orthopedic surgeon. But a plastic surgeon is equally at home working sometimes with an ophthalmologist, sometimes with a gynecologist, and sometimes solving problems in cardiothoracic surgery, especially when the wound doesn't heal and the sternum is opened up, for example, then they call in a plastic surgeon. So we provide, shall we say, fire engine service? Okay. Sometimes it is that.
This case.
So basically, plastic surgery is able to provide a problem-solving approach and solution to difficult problems in multiple specialties, where it relates to structure, healing, tissue deficiency, and therefore function.
So in short, what is plastic surgery again?
Very difficult. I would say it's a specialty where the surgeon is specially trained to look at problems in an analytical way and find solutions using body's own tissues most of the time, moving tissues around and using all the various skill sets and tricks up the sleeve to solve the problem.
So I think it's more of an art. No wonder our slogan, Dr. Mohan Rangaswamy, where dreams come to reality with precision
Through
and
precision
care.
and care, yes. You made that.
Of course.
You made
yes.
that.
That's why
Okay.
I was
Yeah,
like, no, I
that's
need
why
to
you should
remember
remember.
it. Yeah, I do.
Anyway, it's a nice one.
Amazing.
It's a nice one. Yeah.
Amazing. So let's start alphabetically. We will start with anesthesia, anesthesiology.
Yes, anesthesia is a service provider specialty
Hmm.
which enables surgeons to do surgeries. Okay.
Right.
So how does plastic surgery interface with? So here is the thing. The special technique was invented a couple of decades ago, which is called tumescent anesthesia. Tumescent anesthesia, in which we are making a super dilute local anesthetic solution with some adrenaline. Adrenaline is a medicine that reduces bleeding, as you know. So this medicine is slowly infused into the body until that body part becomes tight.
Right.
So the local anesthetic diffuses and blocks all the nerves, and that whole area is numb while the patient is still conscious. And we can do liposuction, we can do mini tummy tucks, we can do breast surgeries, we can do facelifts, rhinoplasties. A variety of operations are done
Tumescent anesthesia.
just based on this form of anesthesia
Wow.
or targeted nerve blocks. So basically in our training, we become very good at nerve blocks. Okay. So even if the anesthetist is not trained in nerve blocks, which today's anesthetists are, by the way, but there are many that are not,
Right.
we are able to provide nerve blocks and tumescent anesthesia. So what happens? The anesthetist need not give general anesthesia.
Right. We prevent the side effects and
Even
all
if the
that.
anesthetist is giving general anesthesia, the amount of drugs they need to use is much less. My anesthetists routinely tell me, Dr. Mohan, for your cases, we don't have to use much drugs.
Right.
So which means the patient recovers very quickly.
Right.
Okay. And
So that's an advantage.
That's an
that
advantage.
patient recovers quickly.
So therefore, we involve ourselves more with the anesthetist in planning the anesthesia, so to speak. Sometimes we say, okay, I will give this nerve block and this, you just give the sedation, we will finish the work on the back, then we'll ask the patient to turn, she will turn herself, then I will finish this part still under local anesthetic, then finally you can give general anesthesia for the more difficult part.
So this is 360-degree
Correction.
transformation that we are talking
Correction,
about.
yeah.
Right.
So what happens? We have an active dialogue and a combined plan,
Right.
which sometimes doesn't happen routinely in many other specialties. The anesthetist will give general anesthesia and the surgeon will perform the surgery and that's it.
Right.
Okay. So, but here we involve ourselves more with it. Sometimes we provide good local anesthetic. Say a medically compromised patient needs a procedure.
Right.
So I can give the local anesthetic and I can perform it under local gently, slowly. Well, the anesthetist will just monitor the health of the patient. So it extends the possibilities this way.
This is very nice.
Yes. So this is true.
Especially in
And
compromised
sometimes, especially I would talk about myself because I'm used to nerve blocks and I've been doing that for all my life. So sometimes for chronic pain, unusual pain syndromes, sometimes cancer pain, these sort of situations, I do nerve block and I do a trial nerve block, and after that I use alcohol to destroy that particular nerve, which is the cause of the pain. So I'm also somewhat involved in this aspect of.
That's wonderful.
pain control.
Which all pain you mentioned again? I'm sorry.
See, for example, I can recollect a patient who had terminal cancer and who was really suffering, and morphine and these type of drugs are not easily available here.
Right.
So it was related to the ribs. So I went and blocked 3 of his intercostal nerves, and he was totally relieved. And then I replaced the local anesthetic with a tiny amount of alcohol to destroy those nerves. Then his wife wrote to me from South Africa after 2 months that he had a peaceful end, and all the while he was relieved of pain. And thank you, doctor. So it's got nothing to do with plastic surgery, but
True.
the knowledge and skills that we have can be applied in other specialties.
Right.
Sometimes in unusual situations, we can do that. Like, let's say a neurological patient who's got strokes and is very stiff like that,
Right.
and the nurse is not able to take care of him, the family is not able to take care of him.
It's too much of
So-
stiffness after the stroke.
Yeah.
Right.
So we are experts in Botox. So I could Botox some of his muscles to relax them. I could block his obturator nerve. And once I saw that there is
The
a
thighs, right?
inner thighs, and I saw that the legs relax and the crossing of the legs is gone. So then I destroyed that particular nerve permanently with a little bit of alcohol, and the problem was solved. So,
Right.
so plastic surgeon skills come in useful in many other specialties.
But this is very good. People must have heard of general anesthesia, local anesthesia, but this
So this is a form of local anesthesia, which is called tumor stent anesthesia. So we do a lot of surgeries under tumor stent anesthesia. So that completes some aspects of our interaction with the anesthetist and with the field of anesthesia and pain relief.
Right. So
Yeah.
even patients can ask for this anesthesia if they don't want to undergo the general anesthesia and
A
they're
lot
having
of
their
patients,
side effects.
a lot of patients, when they come to see me, one of the questions they ask, doctor, will I have general anesthesia? And when I tell them, no, I can do it under tumor stent plus sedation, they are immediately relieved. Oh, thank you, doctor. I didn't want a general anesthesia. Not that general anesthesia is bad, but it is not necessary in many of our surgeries, and the patients actually feel more relieved to hear that, and they it's a matter of what shall I say, relief that you are not made unconscious.
Right. It's more
You're
of a
just sleeping.
psychological comfort.
So you're just sleeping.
Yeah.
You're just sleeping through the surgery.
Right,
Yeah.
right. Wonderful.
yeah.
So there we finish
So
anesthesia. We don't feel like finishing it because it's so much,
Well, we
so
have
much of
from
nice
A
information.
to Z.
Oh,
There are
yes,
26
a lot to
alphabets.
cover. Yes. Then coming to B. Okay, let's go to B.
Okay.
Bariatric, right?
Yeah. So bariatric surgery, for those that don't know, is a field of surgery which is concerned with overweight people and specifically targets people who are super heavyweight. And there are a whole lot of surgeries. You might have heard of sleeve gastrectomy, gastric bypass, and so on, mini bypass, and so on. So these are surgeries that are designed in a way that the patient will lose a lot of weight. So when somebody loses a lot of weight, the tissues are going to be lax and they're going to move south by gravity.
Right.
So plastic surgeon's role is to rebuild this body, different parts of the body, so that we restore back a body that when a person looks at himself or herself without dress,
It's a well-toned.
it is at least not looking so ugly. Let me put it that way, because although when somebody loses weight, his health improves, he feels lighter, his mobility improves, diabetes kind of goes away, hypertension goes away, a lot of health benefits. But then when they look at themselves in front of the mirror, they see a sad figure, right? And they are distinctly unhappy seeing these huge folds and folds of skin, and where is the shape and where am I in the middle of all of this?
True, after doing such a massive procedure.
Yeah. Plastic surgery comes to the rescue in treating these kind of massive deformities, which is heretofore before not seen. Only since bariatric surgery came to the fore, we are seeing such deformities, which we never saw before. So new techniques had to be invented, innovated, or adapted from previously known techniques, had to be adapted to deal with this massive influx of patients with big excess of tissues and skin.
Right.
Now, there are special problems in these people where they tend to bleed a little bit more, they tolerate complications poorly, and the amount of tissues that has to be removed and tightened is surprisingly huge. So an inexperienced surgeon might be a little bit timid and might take out less. Whereas an over-enthusiastic surgeon, throwing caution to the winds, might take out so much that closure becomes difficult, and then the wound disrupts. So you have to have right judgment, correct technique, experience, and do things in a proper way. So there is a lot of surgical work out there in post-bariatric people. But at the same time, what often happens is the patient comes to us first, thinking that liposuction will solve their obesity problem.
Right.
And we then explain to them about the realities and guide them to see the bariatric surgeons. So therefore, there is a close cooperation between bariatric surgeons and plastic surgeons in doing a combined management of these people. And then when we give them the hope that, okay, when you lose weight, don't worry, I'm here to take care of your body reconstruction.
Right.
And we show them pictures, and so that motivates them to go for the bariatric surgery.
That's wonderful.
Yeah.
That's
So
wonderful.
that's where
So bariatric
these two
there has to work together
with
to get
plastic.
the desired results.
Yes, correct.
Okay, so that was bariatric. Amazing. Coming to C. C for cosmetology.
Cosmetology. And
A big
D,
confusion between plastic surgeon and cosmetology in the world of the body. Let's
that's
clear
right.
that out.
That's right.
Yeah.
So a plastic surgeon is a surgeon with full surgical training and then further training in plastic surgery. And so basically, he or she is a surgeon. Now, we do non-surgical things as well. We also do fillers, Botox, thread lifts, and all these kind of non-surgical things. But that's not our core curriculum, and that's not the only thing that we do. But we also do that. Whereas if you say take a cosmetologist, that is a basic doctor who has done courses in cosmetic work and is not a surgeon. So they are not licensed to do surgical work, but they can do non-surgical things, minimal invasive things.
Injectables.
So injectables, some thread lifts, some treatments with machines like lasers and light sources and some other equipment. And they can oversee aestheticians or spa therapists who are doing various using toning machines and various other pampering machines, let's say,
Right.
in a medical spa, for example. So they have to work under the supervision of a cosmetologist. Sometimes a cosmetologist may also be laser certified, so they can do laser. So it's not really a competition, but the problem is people don't know sometimes where to go. Sometimes they go to a cosmetologist, get a variety of things done, and persist in doing many things of techniques where really they need a surgery because their problem is a little bit more advanced. If it is early problems, maintaining your beauty, maintaining the aesthetics, yes, a cosmetologist is of great help.
Right. I have a question here.
Yes.
There is, doing the fillers also lifts up the lips. But I've seen many procedures where you do this cut under the nose, near the nostril,
surgical
and then
lip lift. Surgical lip
What will
lift.
be the difference between both?
So the difference is when the lip height is like vertical height of the lip is long. See what happens as part of aging, a lot of people's upper lip becomes long. In some people, it is a distinct problem. You can see it. And if you compare with their younger age photographs, you can see that the upper lip has distinctly grown longer. And making the upper lip shorter by working under the nose, taking out a strip of skin like a bullhorn,
Right.
and doing it neatly and nicely, lifts the lip, reduces this distance, and contributes to the youthful appearance of the
Well,
face.
this is very important
It's very
because
effective.
trust me, cosmetologists prefer doing fillers and trying to lift their lip up, which looks very ugly at the end of the day, I
Yes,
feel.
correct. Now, for a patient, it becomes difficult. Now, if cosmetologist is in a solo practice, then he or she is only treating these conditions, and so treating with the 5 or 6 things that they have in their armamentarium.
True.
The plastic surgeon has 50 things in his armamentarium. So, maybe a patient should sometimes take a consultation in both places, see what the advice each one gives, and try to see how to combine the two, or where they feel more comfortable, where it sounds more logical. If the plastic surgeon can show that, look, your vertical lip height is high by actual measurements and by comparing to photographs, and educating the patient on what happens with aging, and there are these golden ratios that we talk about.
Right.
So if it is not in the proper ratio, then the upper lip has to be shortened, and that's more logical.
Right.
But somebody may be very scared of surgery and might therefore want to.
Well, this is not always a reason. I would like our audience to know that always having, I always encourage second medical opinion.
Of
You should
course,
always
of
have
course.
this, because certain doctors, when they are not, if a procedure doesn't fall in their domain, they tend to do whatever is possible by their hands,
By
but they
their
don't
hands,
know that,
correct.
refer, maybe it will, you will come across better results. So thinking again about the patient, what is to be done at the end of the day. So always having second opinion.
So if you want to decorate your house, you go to a paint shop and then they will give you various choices of paint. But even wallpaper exists.
Yeah, true.
So you have a choice between painting and wallpaper.
True.
Something like that.
So who is wallpaper, who is painting?
No, I'm not saying
No.
anything. I'm not saying anything. I'm just saying there is a choice.
Sarcastic.
There's a choice.
No, but definitely people should have second opinion and discuss and understand that it's not just getting into unrealistic expectations by some injectables. Okay, we do inject and get this shape. It's not always possible.
So let me bring another twist to it. For example, if cosmetology is also practiced by dermatologists. So dermatologists are qualified specialists dealing with skin diseases.
You took my D.
Yes,
It's D.
I brought it to D.
All right.
Okay,
let's
no
go ahead.
problem. Because cosmetology and dermatology
Very
sometimes
closely
nowadays
related.
very closely related.
Yes.
So there is medical dermatology. For example, a medical dermatologist might diagnose a skin cancer and then they refer to plastic surgeons. So I work closely with the medical dermatologist in providing surgical help, surgical solutions to many problems. For example, biopsies, especially in the facial region. To establish a diagnosis, I perform the biopsies because I can give a nice scar and make the biopsy aesthetic. Secondly, skin cancers, they are all referred to me from the place where I work. I am surrounded by 3 dermatologists. So the skin cancers get funneled into me. Okay, so we treat skin cancers. Then we treat some uncommon skin conditions for which there is no medical solution. Or the medical solution is expensive or not that effective or has to be used in combination with surgery. For example, hidradenitis. Hidradenitis is a condition where they get boils and painful nodules in the underarm, sometimes in the groin. It's a chronic condition. They really suffer a lot for many, many years. No proper good medical treatment is there. Now there are some drugs, of course, but they are a bit expensive. So we have very good surgical solutions for localized hidradenitis. And so those kind of conditions I treat. There are conditions where people are having excessive sweating in the palms and underarms.
Right.
I provide Botox treatments for them. So every day I get referrals from dermatology. Okay. And the other way around, we refer or take opinion of dermatologists when it comes purely the matter of skin.
Okay.
Then the patient's interests are best served in the aesthetic field also. The plastic surgeon, let's say, would do a facelift. But what about improving the tone of the skin? What about improving the appearance of the skin itself?
Right.
So maybe I prefer to refer it to a good cosmetologist or a dermatologist to do the laser treatment, IPL light treatments, do some peelings, and remarkable improvement in the skin quality and the light reflection by undergoing some peelings. Sometimes I find it expedient to refer to them for the Botox and fillers because I may be busy with something else. So if there is no business competition or if you have a good understanding back and forth. So I refer some cases, and then you refer some cases. So we are all working in tandem together for the best benefit of the patient.
Absolutely.
And then the profit and the money matter doesn't come into the picture at all. And that's how medicine should be practiced.
True.
The patient is at the center of this. And your only concern should be what is best for the patient and who can do it the best.
Very true.
If I think that this person can do this very well and is experienced in laser or IPL or whatever, doing it every day, maybe I do it once or twice in a month, I would rather defer to their expertise.
True.
Yeah.
Coming to the palmar sweating, I mean, this is very kind of common. I'm sure people must be having a bit of fear before going to Botox. I mean, where you will inject, how you will inject.
Okay.
Hyperhidrosis, right?
Hyperhidrosis. So the injections are actually into the palm skin and there are multiple injections.
Like the fillers.
But very superficial. So in very, very tiny needle. I will not say it's painless. I will certainly not say that. Yes, there is some pain involved. But we apply the local anesthetic cream for an extended period of time under occlusion. And then it is comfortable. Sometimes if the patient is very squeamish or we find that the patient's pain tolerance is very poor, we can even do it under sedation. And I often do that. So the anesthetist will give sedation, the patient will be deep asleep, will not feel the injections, and then I can quickly finish the injections. So about 25 to 30 small micro injections in each palm, and the palm is dry for the next 6 to 8 months.
6 to 8 months it works.
Very effective.
An immediate effect.
No, effect starts in 4 days.
Wonderful.
So there are a lot of patients that I have treated in this way, and it all starts in school age. Can you imagine? They touch their textbooks and the textbooks have a wet mark. The other friends don't want to even touch them. And later in professional life, they are hesitant to shake hands with another person. And if they did shake hand, the other person immediately wipes because they feel the wetness. It's a social embarrassment. It's awkward. It's very awkward. It's not to be underestimated. And the effect that has on the person's personality is not to be underestimated.
True.
And I have some very grateful patients who say, "Doctor, you changed my life." Such a simple thing.
True. Such a small procedure.
Yes.
So kids also, I mean, we can do it under sedation.
Yes, under sedation. Yes.
Any nerve block possibility here?
I have done it under wrist block.
Works.
That also is perfect. Yes. Yes.
Great. So, I mean, if somebody doesn't want to sleep.
Wrist block. Wrist block.
Right.
So local anesthetic cream under occlusion or wrist block or sedation.
Wonderful. So let's not ignore this, and there is a solution for
There
this.
is a solution available for
Absolutely
this.
wonderful.
Exactly.
So we covered D. You already switched to D. You took my D. We come to endocrinology,
Okay.
right?
So in endocrinology, we have a few areas where we can help, plastic surgeons can help. For example, hypogonadism, where the gonads are not working very well.
Right.
Then such boys may tend to have breast enlargement, breast.
So hormonal
development.
imbalance
Hormonal
in
imbalance,
males
yes.
is called as the
and leads to gynecomastia.
right.
And very often there is no hormonal imbalance. Gynecomastia is a standalone, condition.
Right.
Without
any causative
without any
factors.
causative factor, without any known identifiable cause. Mostly it is related to obesity. When the boy is overweight, the normal testosterone gets converted to estrogen. Estrogen is female hormone. So the male hormone gets converted partly to female hormone in fat. Let's think of excess fat as a factory. As a factory through which testosterone goes in and out comes a little bit of
Estrogen.
female hormone, and that female hormone is going to circulate in the blood and give rise to breast development. Now let's say this person loses weight, but the breast is not going to regress
Because
back
it's hormonal.
because it has developed properly as equivalent of a female breast. So we need to remove that. Otherwise the boy is very embarrassed and doesn't want to go out, do sports or play games, or where he tends to wear baggy dress and crouches, and it affects their posture.
Right.
Almost invariably I see they have a stooped posture because they're trying to hide this like that,
Right.
and their confidence level is low.
Right.
So it's easy to correct this.
And I heard you do it under local anesthesia.
Yes, local anesthesia with sedation.
Right.
The same.
Wonderful.
The tumescent with
Yeah,
sedation.
the tumescent with sedation. Wonderful.
So in endocrinology,
Same day discharge, right?
Same day discharge.
And no
yes.
pain post procedure?
No, hardly any.
Hardly any.
Easily controlled by tablets.
Any age?
Well, the usual age where this condition appears and where the embarrassment is there. Suppose before 18, we need a parental consent. After 18 years, the person can sign himself.
So
Yes.
that's in endocrinology, the gynecomastia we covered.
Yes.
What other conditions we have?
Well, sometimes if I'm running a very active laser hair removal service, which I will not do, the technician will do under my supervision, let's say. So hirsutism in women, facial
Right.
hair,
Right.
very good solution in laser hair removal, right?
Cool. So we cover endocrinology.
They have stretch marks, for example.
Uh-huh.
Many of them in Cushing's, for example, there is stretch marks. So again, we have solutions for stretch marks. So basically, endocrinology where there are, again, physical alterations in different parts of the body,
True.
which the plastic surgeon can solve.
Hormone related anywhere, any
That's right.
aesthetically, if
That's
you come
right.
across,
That's
it has
right.
to be
That's
referred.
right.
It should be referred.
Thyroidectomy scar, sometimes the scar goes thick.
It's on the neck.
So that's basically to do with scar improvement. Any scar that is looking bad, plastic surgeons can offer solutions to improve the scar.
Thyroidectomy, I think, is a very common condition where
Yeah, we don't
can
perform
get referred.
thyroidectomy.
I mean, the for the scar revision,
The scar,
basically.
yes.
Nice, great. So that's endocrinology. Coming to your favorite one, the family medicine.
Okay.
F.
So a family medicine is or a GP. This is the go-to person for a lot of people. Their first point of call in case they are having any medical issues. So it's important to educate the family physicians how a plastic surgeon can be of service.
Can we differentiate between family medicine and the GP doctors for our audience?
Well, I myself don't know the difference, to be honest.
Okay.
Let's put it this way.
I
that,
think it goes
that,
to all genders. Family medicine
that-
can see all, even pediatrics they can
No,
see.
let's put it this way, that GP or general practitioner used to be the nomenclature earlier. Now people prefer to call it as family medicine. Because when you say family medicine, the whole family, therefore all members of the family, therefore children, adults, geriatrics, everybody.
Right.
And the GP used to do that.
Ah.
So in some countries it is GP, in some countries it's family medicine.
Well, here still family medicine is preferred over GP. I mean, surprisingly. I mean, the trend.
I don't know. I have not really tried to dissect or split hairs between the two
Okay.
names.
Cool. Perfect. So coming to the referrals, what kind of cases? So I think GP and family medicine are the first point of contact when.
Yeah. So they need to know the wide variety of things that we do. Okay, not just related to, let's say, body shape, body appearance. Okay, wound healing. Let's say sometimes nerve problems like carpal tunnel syndrome. Okay, we'll discuss it under neurology.
Okay.
Sometimes wounds that are difficult to heal, minor burns. The GP or a family physician may be consulted for minor injuries, pediatric injuries, burns. Okay, they need to know how to do the first aid care, and then which cases to refer to plastic surgeon or take an opinion. What I would like to say to the GPs and family medicine specialists out there is that if you are in doubt and you think that remotely, yes, maybe a plastic surgeon can have some solution for this, or can be consulted, please do not hesitate. Pick up the phone and talk to me or to any other plastic surgeon, and we'll tell you, yes, this is a case for us, or we have nothing to do with this.
That's very important. I think they are the first point of contact and understanding what's required, and then being open to discuss is something which
they will be
is
able
very
to
good.
guide the patient,
Right.
and to do that, they themselves must have a basic knowledge about what a plastic surgeon does, because sometimes the patient will go back to them to ask for more questions and more clarifications.
Right.
Or they would ask the family physician, doctor, what do you think? Do you think I should undergo this liposuction?
Exactly.
Now, many of them have negative ideas about plastic surgery. Okay. We are a little bit of a maligned specialty, if you would say, because some bad press that we get, or people have this wrong idea, and surprisingly doctors have this wrong idea, oh, liposuction is just for weight loss. It is not for weight loss, it is for body reshaping. Or they have this opinion that, these things are dangerous. Why do you need it? It's unnecessary, don't go for it. That would probably the advice that a family physician would give to their trusted patients. So because they have some negativity because of ignorance. So this is where dialogue and consulting, and then we can advise the patient together.
True.
Or if there is any difference, or if there are any special concerns that the family physician, because the family physician knows that patient more than I do.
Right.
So they may voice
Absolutely.
special
I mean,
concerns.
each and everything they will go and discuss. Gynecology problem they will discuss with family medicine. Urology, hepatology,
Exactly.
gastro. It's a
Exactly.
very wide.
So for
area.
example, quality of life issues. There may not be any medical stuff. Quality
true.
of life issues,
Very
and
true.
many quality of life issues, plastic surgeons have a role to play. ENT is the ear and nose and throat, and this is in this facial and neck area where we are also working. So one area of cooperation obviously is rhinoplasty. There are many ENT surgeons who perform rhinoplasty rather well, and they have an interest in it, and that's good. But there are many that don't. They choose not to do rhinoplasties. So they may refer rhinoplasties to a plastic surgeon, but they do septum. Septum is the structure between the right and the left, and sometimes it is deviated, is causing breathing obstruction. And they do the septum work, they do the turbinate work. So what happens is, if I combine together and we operate together, the ENT surgeon can do the septum work, then they usually remove the piece of cartilage from there which is deviated. But that piece of cartilage is invaluable to me. For the rhinoplasty, I can make grafts using this cartilage. So it makes sense, if the patient is also thinking of doing a rhinoplasty for the shape of the nose, to combine with an ENT if there is a deviated septum, and this combination works beautifully.
Wonderful.
Okay. Again, there are cases, children born with deformed ears, and some of them also have hearing problems. Okay, so the ENT surgeon can refer these children born without a ear or deformed ear, and plastic surgeons can reconstruct.
You can make a ear.
Make a
like
ear.
You build a nose for that
Yes.
acid attack patient.
Yes.
Yes.
So it falls within the purview of plastic surgeons to do a total ear reconstruction, or prominent ears, or all those myriad ear deformities, whether by birth or by injury or by cancer or whatever. We can do very nice work on ear reconstructions. So these are two obvious areas. Other than that, there is facial,
cleft palate is
lip
also
and
something
palate
which is followed.
is, yes. ENT people normally don't do this. Plastic surgeons do.
This cases goes to who
It
exactly?
depends on the country, depends on the local dynamics and how the licensing is done. For example, plastic surgeons and maxillofacial surgeons both are capable and licensed to do cleft. And in some countries also ENT surgeons can do the clefts. But in cleft palate cases, for example, I interact with the ENT doctor because the cleft palate babies have obstruction in the middle ear. So invariably they have to see an ENT doctor,
Right.
and they have to be on follow-up for the hearing and for the insertion of grommets and all that. And then again we will collaborate with the ENT doctor for how the soft palate works. There's something called velopharyngeal incompetence. So this is an area of active collaboration. Also there are some malignancies, some cancers where the ENT doctor might do the resection, and I will come and do the rebuilding of that area. So
Right.
because we are both working on the face, and we are both very comfortable and familiar with face and facial anatomy, so it's an area where collaboration is possible and is done every day.
Right.
Yep.
Oral cancers cases are also
That is
lot of
true.
there.
Oral cancers generally are dealt with by surgical oncologists, but in some places, yes, ENT surgeons
No
are.
plastic surgery role.
Of course, plastic
Because
surgeons.
aesthetically it affects a lot.
Absolutely. This is reconstructive, and this is a major area of reconstruction called head and neck reconstruction for cancers in the mouth and around. So it's a big problem in India, as you know, because of oral tobacco usage, and the world over. Plastic surgeons use their innovative and reconstructive skills to reconstruct the lip, the mouth, the tongue, the jaw, everything after a cancer surgery.
Right.
So this is also an area of cooperation.
So next, coming to G, gastroenterology.
So there is not any direct collaboration between gastroenterologists and plastic surgeons.
Gastrosurgery we were
But
talking about.
gastrosurgeons sometimes have cases where we can help. For example, they may make a colostomy, and then around the colostomy there may be wound problems, healing problems. Sometimes they have complex hernias where they call our help. Sometimes there are major cancers in the rectum and anal canal where a big surgery is done, there is radiation done, sometimes the wound doesn't heal. So these are some areas where plastic surgeons can offer their help and services. Sometimes we need to do flap surgeries for these things. So other than that, in the day-to-day running of our respective specialties, there is not much of interaction. But we are always available as problem-solving specialties. You have a problem with the structure, with the wound, with the tissue loss,
healing and all.
we can offer our services.
Wonderful. So that's gastroenterology. So we talk about hand.
So here there is an important message I want to give. Hand in many places is an orphan. Somehow it falls between specialties. Like a hand injury, shall we call the surgeon? Shall we refer it to orthopedic? Usually people don't think of plastic unless they know, unless the system exists in a particular hospital. So they'll call the surgeon or the orthopedic. In the vast majority, and I don't mean disrespect to anybody, a general surgeon is not so keen and not so well versed in hand to do the nuances and repair the injuries and all that. Orthopedic, yes, maybe, sometimes yes, sometimes no. So what happens? Hand kind of gets neglected. Or some work is done and it is left to the physiotherapist to carry on doing physiotherapy.
Strengthening exercises and all.
Hand is a very delicate organ. It's the most functional organ, one of the most functional organs in human body. We earn our living with hands. We express with hands. We feel and touch with hands. And you only realize the importance of a hand when you have an injury and you know that you cannot use this finger or this finger or this hand.
I got a cut.
You have to struggle
morning.
With one hand to do everything.
I just got a cut today morning and I'm feeling like, I can feel that.
Right.
It's important.
So the thing is, plastic surgeons, those whose residency involves training in hand. Again, not all plastic surgery residency programs offer hand. Okay, I am fortunate that I come from a program where hand is an integral part of plastic surgery department. So what happens, what I want to say is hand is very dense. In every square centimeter, there are a lot of structures. And they all work in such a beautiful symphony. You just have to see a musician play the musical instrument. And if you know hand anatomy and if you know a little bit of biology and medicine, you wonder how that hand is working. And then if that hand has an injury, a nerve injury or a tendon injury, you got to restore that hand to the level that that musician can play the instrument with the same gusto as if no injury happened. We often say that when a hand injury has been properly repaired and rehabilitated, the person starts speaking with the hand. See, we make movements with the hands, right? And that stops when the hand is injured or is not okay. When the hand is completely okay, that starts again.
Right. So let's move hands and talk. Okay, let's feel our hands. Okay.
So,
that's wonderful.
So hand injuries,
right.
Congenital by birth deformities like conjoined fingers like syndactyly. A syndactyly badly operated can be ruined. And that child's 2 fingers are gone like non-functional for life if it is not properly done in childhood. Okay, so it's that important. So diseases like rheumatoid arthritis, injuries mostly, they need to be and burns.
Right.
So there's a vast area of contractures. There's a big area, arthritis. So hand area that is very dear and close to me and also to many plastic surgeons. And also this is an area where we collaborate with orthopedicians also. I often do cases together and for the best benefit of the patient.
Wonderful. That's a very important...
That's hand, very important message.
That was hand. So coming to eye, that's infectious diseases. Do we have any role?
Yes, plastic surgeons have a role in devastating infections like necrotizing fasciitis.
Oh yes, Mark. We had Mark, yes.
Yes, necrotizing fasciitis. Necrotizing infections, gas gangrene, that's the severe end of the spectrum. Then the other end of the spectrum where there are infections which are, let's say, treated and controlled, it leaves a tissue defect, like some tissue is lost.
Right.
or there is a wound like a pressure sore. Infectious disease person may get involved. There may be a patient in the ICU having infections,
Bedridden.
so bedridden. So they get involved, and then they call the plastic surgeons to come and see the wound and try to help solve the wound. We advise them in dressings.
I'll tell you, still
specialized
surgeons are
dressing.
called for bed sores.
Well, if a plastic surgeon is
No, a
available,
general surgeon.
right? What happens? What I have noticed is if an active plastic surgeon is available in a hospital, gradually the general surgeons will dissociate themselves from wound care and will say, call the plastic surgeon. Because it's not of core interest to them. They do it when nobody else is there.
Right.
Okay. But when there's a plastic surgeon who then also preferably has, let's say, a wound care nurse, who's also called a tissue viability nurse, specialized nurse, so then they can offer a big service to the community. Okay.
Right.
So a whole lot of chronic wounds, difficult to heal wounds, post-operative wound care, all these things taken care of by the specialized wound care nurse. And the wound care nurse works under supervision and collaboration with the plastic surgeon.
This is very important for our
this
audience.
this is happening in Alzara Hospital, for example. Anywhere in the hospital, any difficult wound will get routed through the nurse to me, and then we will go there, see it together. So here is a specialist doctor and he's a specialist nurse. So there's a condition called lymphedema where the limb undergoes swelling. It can affect the lower limb or the upper limb. It can appear spontaneously in a rare condition, which is called Milroy's disease. It can be secondary to, let's say, filariasis or to a surgery in the lymphatic area, very common after breast cancer surgery and radiation.
Okay.
So the limb undergoes swelling and they do suffer. Okay, so these patients,
How common is this in breast cancer patients?
it's becoming less common now because of better radiation and better surgery, but it is still a common problem. Okay, and Milroy's disease is primary, and secondary lymphedema can also happen after some surgeries and some scarrings and some burns and all that. So lymphology, so this all falls under lymphology, and it's part of our training to recognize, classify, treat, and offer solutions for lymphedema patients. So whether knowingly or unknowingly, eventually the lymphedema patients do get referred to or filtered down to plastic surgery department. It's good if they come early because we know what we are dealing with, we know how to deal with it, we know how to advise the patient and how to maintain and how to follow up and so on. So lymphology comes completely under plastic surgeons or vascular surgeons.
Okay.
And in addition, plastic surgeons, those who are very well trained in microsurgery, what is now called super microsurgery, are actually anastomosing the lymphatic vessels and doing lymph node venous anastomosis. And there are many surgical procedures that have been described which provide relief in lymphatic obstruction.
Vascular surgeons, they do that?
No, plastic surgeons.
Plastic surgeons,
Plastic
they do that.
surgeons with high skill in microsurgery.
Whoa.
And then nowadays, there is also some evidence that fat grafting across the axilla improves the swelling of the limb by promoting formation of new lymphatic vessels.
Wow.
So that is regenerative medicine. So
Wonderful.
briefly, lymphatic problems, lymphology comes under the purview of plastic surgery.
Wonderful.
So in nephrology, one of the problems is renal failure, and for which dialysis is done.
Right.
So for doing effective dialysis, there is something called an AV fistula where you join the artery and the vein. Okay. Plastic surgeons, because they are very skilled in microsurgery, we can perform an AV fistula with a very high rate of patency. In fact, when I was in Oman, I had completed almost 600 cases with 95% plus patency rate because we use microsurgery technique.
Patency is always an issue.
Yes.
Yes.
So you can, today I would say that in an AV fistula, the patency should be 95% plus or no. Cannot accept anything less than
Less
that.
than that. Yeah,
So
absolutely.
plastic surgeons, I feel, need to get involved more in this field because they can really offer the service of making an AV fistula and a good functioning AV fistula is the lifeline of a
True. Of a chronic kidney disease patient.
So here we are able to help.
Wonderful.
Then of course chronic kidney patients sometimes get into all these wound problems and non-healing wounds and those sort of things. We are able to help there. But one main area, and if you remember in our first podcast, I brought home the fact that the first kidney transplant was done by a plastic surgeon. Remember that?
Joseph Murray?
Yes.
Right?
Yes.
I how could I forget that?
So the historical connection with nephrology goes back a long way.
Yes. Nice.
So neurology is an area of, again, active collaboration because plastic surgeons also are very good at peripheral nerve surgery. So problems related to peripheral nerve injuries, nerve stretches, okay, nerve compressions, something like the common carpal tunnel syndrome, which is very, very common, all these things can be very nicely solved by plastic surgeons. So neurologist, therefore, because we are good at, we are experienced in usage of Botox, many neurologists like to refer these movement disorders to us, and I'm doing treatment for all these blepharospasms and torticollis. This is condition where the neck turns to one side. Cerebral palsy, where there is muscle spasm, we are able to treat that with Botox. So since we are good at Botox for a variety of indications, some of the neurologists prefer to refer their patients to us, those patients who are having movement disorders, spasms in the face, uncontrollable spasms. So I'm able to treat many of them and with a good relief. And as you mentioned, also in selected cases of migraine where there's a trigger point, Botox helps. And nowadays there is also an emerging field of what is called migraine surgery, where there is some vessels which are overlapping a nerve, and by clipping or tying that particular vessel and cutting it, is a highly selected group of patients, the migraine is relieved. I'm not claiming to be an expert on migraine at all, don't get me wrong. That has to be with the neurologist, and there are a whole variety of medications for it. But out of the migraine patients, there are a few who have specific trigger points, and then Botox helps them. We have interactions with neurosurgery in some of the cranial tumors where there is a reconstruction necessary for reconstructing the scalp or the bone. And in fact, one branch of plastic surgery deals exclusively with remodeling the whole cranium and the face.
Really?
Yes, and this is called craniofacial surgery. And craniofacial surgeons usually come from plastic surgery background, and they hyper specialize in craniofacial surgery, and it's one of those magical surgical lines where great transformations are possible, and it's one of the essential services in a country, in every country, for example. So many countries have one or two specific referral hospitals where all the craniofacial surgeries need to be referred, because it's a high-tech area where neurosurgeons and plastic surgeons collaborate very actively.
But it's highly ignored also. After craniotomy, I have not seen many people...
No, craniofacial surgery in this country is yet to be developed fully, but Oman has a very good craniofacial center, and India has very good. Many advanced countries, medically advanced countries, have craniofacial surgery well established. Neurosurgery.
Yes. Would you like to highlight something about mental health?
Well, mental health, we don't have too much to offer to mental health patients, but on the other hand, we need the help of the mental health specialists to evaluate many of our patients and support them sometimes through the emotional upheavals when they undergo some body transformations, or we need to identify and probably not operate on people who have this condition called body dysmorphic disorder. And sometimes if we are in doubt, we may refer such patients to mental health specialists to tell me whether it's okay to operate on this patient or not.
Right. Whether it's going to solve the problem or not.
Or not. Okay.
True.
So yeah, we do need to collaborate with them.
Right.
But in a reverse way, there are very few situations where we can help them. Maybe they identify some patients where a particular physical feature is really the cause of the problem, bothering them. And then the mental health specialist may say, okay, doctor, if you can fix this, I think my patient will be happier.
Okay.
Yeah.
True.
Oncology, orthopedic, OB-GYN.
Oh my goodness, so many.
Let's
take one at a time.
It's a big alphabet. It's a big alphabet.
Yes.
So oncology, it's obvious that oncology is a field where the surgical oncologists especially, they do surgeries. Whether it is breast cancer surgery or any other part of the body. Now, cancer surgery results in big loss of tissue, and that loss of tissue may require replacement, reconstruction. So this is where plastic surgeons come in. Breast reconstruction, as you very well know, is an area of active collaboration between the breast oncosurgeon and plastic surgeon.
Andrea, my favorite.
Yes. And we are doing that every week.
Right.
Okay. Then head and neck reconstruction is a big area where again plastic surgeons collaborate with surgical oncologists. Limb sarcoma tumors in the limbs. So basically oncology does have business for plastic surgeons, and it's an area where we have contributed immensely. When I say we, as a specialty, plastic surgery has contributed immensely and actually positively influenced the course of cancer patients' quality of life and recovery. Imagine the difference between a radical mastectomy patient and a patient who has a prophylactic mastectomy, because reconstruction is so good advanced nowadays. And then not to forget all these flaps, microvascular flaps for breast reconstruction, and which have really shortened the patient's recovery and immensely improved the quality of life. that the missing organ can be replaced by free flap surgeries or local flap surgeries.
Right.
Okay, so that's oncology. Then we have orthopedic for O, and orthopedic is an area where we collaborate every week, because orthopedics, it's a vast field. They deal with trauma, they deal with joint replacement, they deal with fractures, and so on and so forth. Sometimes they have wound healing problems. Sometimes the bone is exposed. Sometimes the joint replacement hardware is exposed. The plates and screws get exposed. So they need a plastic surgeon, and better refer early so that we can take care of the wound, control the sepsis there, and do a flap surgery to cover. And today we are able to do some of this under regenerative medicine. That means we are using the patient's own body fat and PRP, and I have published on this.
Your secret.
Well, it's not my secret. It's an emerging field.
Fat,
It's an
fat
emerging.
with the
It's
PRP.
regenerative is the field for today and tomorrow and for the future. So we are able to offer these services, and there are areas where orthopedic and plastic work together at the same time to solve problems. For example, there are chopped hands that are brought to us, chopped fingers, so the bone will be fixed by the orthopedician, and then we deal with the soft tissues and the blood vessels. So orthopedic and plastic collaboration. In fact, there are some hospitals and units which they have an orthoplast clinic.
Oh, really?
Orthoplast clinic. And also like neuroplastica. There's also neuroplastica.
Really?
Yes. So
That's nice.
these are specialized clinics where such cases get referred, and they are seen together,
Together.
multidisciplinary team. So orthoplastic exists, neuroplastica exists. And OB-GYNEC is again an area where women go to their gynecologist for most of their problems, let's say. So post-delivery issues, after the family childbirth period is over, the mother may have loose abdomen, falling abdomen, separation of the abdominal muscles, bulging, hernias, all these kind of things, breast problems. So in a procedure called mommy makeover, we deal with the breast, we deal with the tummy and the body contouring. There's also another area where the genital area may be injured due to childbirth or changes there due to aging, weight loss, various other hormonal changes. So we are able to offer good solutions to restore that area to near normal condition by a combination of surgical and non-surgical. And here I want to mention one condition called lichen sclerosis. Lichen sclerosis is a painful condition in the vaginal area for which there was no good solution. And today, will you believe it or not, plastic surgery is specialty to treat this because we can do fat grafting.
Whoa.
And fat grafting seems to have a lot of benefit in this lichen sclerosis. So I would encourage referrals for this condition.
That's wonderful.
And there are many studies being published that fat grafting will help this lichen sclerosis.
So we have many alphabets left still to discuss.
Yes.
I think we need one more episode of this. Audience, please stay tuned. This is the second episode of our this season where we are talking about how the collaboration between plastic surgery and other specialists, it goes well. It's for your awareness as well, so that you can interact with your specialist or your doctors and understand where we can have support of a plastic surgeon and where they can be involved for more benefit. Basically, at the end of the day, we want patients benefit, so that collaboration is very important. In our next episode, we'll bring up the further leftover letters
from P onwards
to Z. Yeah, we'll try to find something with Z.
I'm sure there will be
yeah,
something.
we will be finding out something.
The more you explore this, the more you realize in how many areas a plastic surgeon can contribute. And so we have our finger in many pies, so to speak. But it's a matter of great happiness and satisfaction for me, especially so because I get the feeling that my basic medical MBBS education has not gone to waste. I still remember enough of my ophthalmology, ENT and OB-GYNEC and this and that and everything to be able to apply that basic knowledge to application of plastic surgery in those respective fields. So it's a matter of intellectual satisfaction to be able to do these procedures in different specialties and provide also this, problem solving and fire service
True. Fire service, the rescue service.
Rescue service. Plastic surgeon to the rescue.
Very true.
Sort of
And it's very important, and it's a very great gesture. It's a great gesture from Dr. Mohan that we'll be dropping the number in description. Feel free to discuss if you have any doubt wherever we need his support, or you feel like we should involve a plastic surgeon or have his opinion. Feel free to reach out, and we
And I'd
have
like to say to like, share,
and subscribe. Yes, please, definitely. And let's work together
to increase our reach.
Yes. And for patients' benefit at the end of the day. Yes.
Thank you, Dr.
Thank you
Anita.
so much,
Thank
Dr.
you very
Mohan.
much.
Thank you.
Thank you. Bye-bye.